Cloudy vision can be a normal part of aging, but it can also mean something more serious. And that's why the professionals at Eye Care Associates are here to speak to us about the subject of cataracts. We're joined by Dr. Yakubo. Welcome to the program.
Thank you very much.
Doctor, can you explain to our viewers exactly what a cataract is?
A cataract is actually a clouding of the natural lens inside the eye. It's in a sac, basically, right behind the colored part of the eye, and it's layers. I would say layers like an onion, and those layers start to get cloudy and thicker as we grow older.
How do we detect this? What are the symptoms for the individual?
Usually it's blurring of vision, glare, nighttime glare, starburst around lights. That's probably one of the primary symptoms that will bring someone into the office to be evaluated. We see it under the microscope, of course, during a normal eye exam.
And do we know what causes cataracts?
Primarily it's just as we get older, and we'll all get them if we live long enough. Other conditions can, however, cause cataracts to form earlier. Some medical conditions like diabetes, if you're a smoker, they will usually, a cataract will form earlier. Some problems, kidney problems, blood pressure problems, some other medical conditions can make a cataract grow faster.
So for you, what sort of tests are done to diagnose and detect the cataracts?
They're usually detected during a normal routine eye exam where we dilate the eye and take a look at every part of the eye, basically, because light has to focus coming into the eye from the cornea to the lens to the retina. So the vision itself, and then we check for glasses prescription to see if that can clear things up and see what the vision is that way. We can do some glare tests that kind of bring out or simulate almost glare at nighttime with driving headlights, street lights, things like that, to see if that makes the vision worse. That would correlate with a cataract. And looking in the slit lamp, which is our microscope, we would be able to see the lens itself and see the cloudiness.
So then once we have a diagnosis, what are the next steps for a patient to treat the condition?
The only way to remove a cataract or get rid of it is by surgery. There's certain criteria on how bad the cataract has to be and how bad the vision has to be, and their level of symptoms where it interferes with driving or seeing street signs or seeing the crawl on a TV. That also qualifies. There's criteria for having cataract surgery.
Dr. Yakubo, thank you so much. Great information. I'm sure a lot of people learned a lot about cataracts.
Very good. I hope it was helpful. Thank you.
And we'll go back and kind of review what we've learned about cataracts. Cataracts are a normal part of aging. Symptoms include fuzzy vision, decreased color perception, and poor night vision. Cataract surgery is the only effective treatment for cataracts. So let's take a quick look at how the basic cataract procedure works.
Usually with cataract surgery, a small incision is made in the eye. The front portion of the thin outer covering of the lens is opened to allow removal of the cataract inside. The cataract is gently broken up and vacuumed out. Then a folded lens implant is inserted through the small incision and into the capsule, where it unfolds and permanently takes the place of the clouded natural lens. With the cataract removed, the new lens implant clearly focuses light rays onto the retina. The power of the lens implant is selected for your individual eye.
We're joined now by Dr. Keith Wilson and Dr. Wang, and they're here to discuss some really exciting advancements in cataract surgery. Welcome to you both.
Thank you.
Dr. Wilson, we just saw in the video how a lens is inserted into the eye in cataract surgery. But I understand that Eye Care Associates is now offering laser cataract surgery. Can you tell me how that's different from traditional cataract surgery?
Yes, cataract surgery is one of the most commonly performed surgeries in the country today. It's very safe and its outcomes are very predictable. We feel with the laser cataract surgery we're able to improve upon these already great outcomes. The laser uses computer imaging of the eye and then uses high-energy femtosecond laser to perform procedures that are typically performed by the surgeon with a blade. These maneuvers are highly dependent on the surgeon's skill, his volume, and his expertise. It really allows us to perform surgery, what we call bladeless cataract surgery. Cataract surgery, you have to make an incision in the eye to gain access to the cataract. And in traditional cataract surgery, that incision is made with a blade. But with the laser, it's made with laser technology so that the incision is more secure, it's more precise, it's watertight, and it doesn't require any sutures to close it.
Any other differences in this procedure than just the bladeless incision?
Yes, there are two additional important advantages that the laser provides us. The laser allows us to make a very precise, what we call capsulotomy, which is an opening in the capsule that surrounds the lens or the cataract. And we feel that this opening that the laser makes is more precise, and studies have shown it's 10 times more accurate than what can be performed manually by the surgeon. And we feel that this is an important difference that allows better centration of the intraocular lens and provides better outcomes for the patient. Another important difference is that the laser allows us to soften the hard core of the nucleus so that we don't need to use quite as much phacoemulsification energy or ultrasonic energy in order to remove the hard core of the lens. And this is advantageous because it provides less stress on the ligaments that hold the lens in place, allows less chance that there's rupture of the capsular membrane, and again, make sure that that lens is centered and provides a better outcome.
And doctor, what about astigmatism? Can the laser also be used to treat astigmatism?
Yes, it can, especially with the advanced technology intraocular lenses that provide good vision without glasses after cataract surgery. It's important that the cataract surgery result in a very minimal amount of astigmatism. Now, traditionally, the surgeon can treat astigmatism using a blade to make incisions in the cornea to reshape it. And that's called astigmatic keratotomy. However, with the laser actually is used to make very precise incisions, and the laser can control the exact location, the depth, and the length of these incisions. So they're very, very accurate.
So Dr. Wang, are there different types of lenses that the patient can choose from?
Yes, there are basically three types of intraocular lens implant. The first type called a monofocal implant, which is the patient after have the implant, they can see really good distance without glasses. For those people who are traditional have to wear glasses for either nearsight and farsighted, this is a great procedure for them because it's almost like you had LASIK surgery. You can see distance now without glasses. Now the second type of the implant called toric implant. With toric implant that the astigmatic correction are carved into the implant. So after this implant put in the patient's eye, the patient can see real good distance without glasses. But all those two kinds, you can see good distance, but you cannot see close up. Now there's a third type, which is called restore or crystal implant. Now this implant, not only that they can see far away, close up, and intermediate visions, so this is called lifestyle implant. So basically, there are three types of implant. The patient will have to go to their doctor, have their health examination. The doctor will recommend which is best implant suit for their eyes.
So does the new laser technology change the lens options for the patient?
Absolutely. As Dr. Wills has mentioned earlier, that the laser cataract surgery is more precise. As good skill as eye surgeons are, we cannot draw two circles exactly the same, but laser can. So laser add a much more precise into the operation. So the result will be much more close to desirable effect. So that's number one. Number two, people with small astigmatism, now they can have this restore a crystal implant with the system of laser to correct the astigmatism during the surgery.
So is there a difference in how you evaluate patients prior to surgery?
Yes, there are. Before the surgery, the patient will come to the doctor. Doctor would evaluate the eyes, like routine cataract surgeries. But in people who want to have this premier or lifestyle implant, we have to do additional testing called topographer. And also all the tests have to be very precise in order to have desirable results. Also, during the surgery, that the machine will be able to measure the eye again in a different way to give more precise results. So there are differences.
Right now, let's take a look at some of the types of lenses we've been discussing, and then hear how these advanced IOLs are making a difference in patients' lives.
Diane couldn't get over how much older I looked. No, the clarity was just unreal. I mean, it's really hard to imagine that there could be that much difference in an hour and a half.
So far, it's wonderful. Yeah. I see like I did when I was a young girl. I felt like I was depressed before. Next day, I was a happy person, excited, and just weight was lifted.
It was wonderful. I could see immediately right after the surgery. And I would run around and close the eye that still had the cataract and look out of the good eye. I couldn't wait to get the second eye done after my first eye and the experience with it. It just completed everything. It was wonderful.